Hello, this is Paulet Downey, and I'm back again with a skincare minute. This segment is going to be on caring for acneic skin, how to care for acne. And so, before I talk about caring for acne, let's talk a bit about acne. And so, acne is basically it is an accumulation of dead skin cells on the follicle hairs and then with a plug of oil on top of it. So basically, with these dead skin cells, they are unable to exfoliate at the pace that they should exfoliate to prevent the acne from happening. So as a result, you get several different variations of acne depending on what is taking place inside the skin. So let's start off with blackheads, comedones, basically. Comedones, blackheads, whiteheads, congestion. So with blackheads, it is a plug of oil, and on plug of oil on the follicle hair, and under that is dead skin cells. And so with a blackhead, is that it has oxidized. So we're looking at an open pore, it has oxidized, and as a result of it oxidizing, the color is black. So it's either grayish black, but it's a dirty kind of looking color, which forms the blackhead. So that's the result of, again, dead skin cells under, like on the hair follicle, and then above that, just where the pore opening is, you have, and this one is open, of course. So you have a plug of oil, preventing the the cells or the oils from releasing. And so that's where you get a blackhead from. With a whitehead, on the other hand, again, we have a plug of oil, and we have dead skin cells underneath of that on the hair follicle, and then we have the pore is closed. There no oxidation has taken place here, and as a result of that, we get a whitehead. And so at the tip of that, we're dealing with a whitehead. And then we have congestion, which is basically a mixture of a blackhead and whitehead, and that is underneath the skin. Again, we're dealing with a plug of oil, preventing the exfoliation of the skin cells from exfoliating. And so this again, so with a congestion, it is under the skin, and that's it's a micro comedone, basically a combination, like I said, of both a whitehead and a blackhead. So that's in the whole comedone family. Now, when we're talking about a more severe case of acne, we're talking about the pustule, or the papule. Let's talk about the papule first. So the papule is basically a red lesion. So it's a red inflamed lesion on the skin, and it's tender and it's sore to the touch. It's inflamed, so it has swollen onto the skin. Now, a pustule, which is the next stage of a papule, is all of that, plus it has the tip of it is either yellow or white pus, which is, eroding from the pustule. So these are more serious forms of acne. And then after that, we have the cyst. And the cyst is basically it is a lesion. Has been inflamed, and it is pale. It's like a lump. It's almost like a lump on the skin, a lump of pale skin, and it's very sore. It's large, and again, it's under the skin, and so that is a more severe version of of acne. And then finally, we have the nodule, which is the cyst, basically, but without the pus. So with the cyst, it does have the pus. With the nodule, it doesn't have the pus. So for a cyst, actually, I'll talk about that later. So these are the various forms of acne. Now, depending on, there are many stages. There are 4 stages of acne. So you have the mild case of acne. So the mild case of acne, basically you're dealing with an oily skin. You're dealing with comedones, both open and closed, as well as some papules. And usually you're dealing with 10 to under 10 papules. And so this is a mild case of acne. So you have your moderate, which the moderate is anywhere from 10 to 25 papules and pustules on the face, also accompanied by open and closed and congestion of comedones. So this is a mild case. And then when we're getting into the mild case, no, so mild case, moderate case, and then I forgot they're severe for the very last one. But after the moderate, then we have from 25 to 50 papules, pustules, and we have everything else, every form of comedones on the skin. You have the cyst as well. You have the cyst and the nodule as well on the skin at this level, and then you have the more severe. I can't believe I forgot that one right above severe. So, but then you have the severe. So the severe is 50 plus papules, pustules, every form of comedone, as well as cysts and nodules. And this is the more serious level. So for level 1 and level 2, these levels you can speak with a beauty consultant. You can speak with an esthetician to help care for your skin at these levels. You can seek out their help and then do have your home care to minimize the acne that you are experiencing on your skin. From anywhere from 25 plus of the papules and the pustules, along with all of the comedones that are on your skin, you will need to seek the professional help of a dermatologist. For anything like that, for the third level, if it's maybe like you can speak with an esthetician or seek a beauty consultant. If it is like maybe between 25 to 30 pustules and papules and some cysts that you are seeing. But after that, you definitely do need to see a dermatologist to help with correcting the acne and alleviating what you are having, what you have on your skin. So now with how to care for the skin, anyone who is suffering from acne, there are plenty of products out there. First, before I even talk about the products, let me talk about the different ways in which you can care for the skin. So you have topical care, which are skincare products. You have oral, which is more, it's prescription, so that is something you definitely would need to get from a dermatologist. Then you have surgeries, and this is to have a surgery. This is in the rare case where a cyst or nodule is so deep that it can, or surgery, I should say, drainage. So that is where the nodule or the cyst is so deep and that it can only be eradicated through drainage. And then also we has there's also injections. So like cortisone injections, and this would be in the cyst, in the nodule, or in a 5 millimeters of or greater in size of a pustule or a papal nodule and cyst. So then you could also have cortisone injected into those, um, alleviating the inflammation immediately, and then the actual pus coming out of the acne, the you know several days later. So those are the options that are available to people who are dealing with acne, and depending on the severity of the acne. Um, I know for myself, when I was dealing with acne, um, I would pop them, and that could cause scarring. And in some, and I became a little bit of an expert to learn how to pop them without scarring. But as if you're not an expert at it, really and truly seek out the advice, seek out the help of an esthetician who can actually remove the pus that is in the skin, or the blackhead or the whitehead, without actually causing any kind of hyperpigmentation or scarring to the skin. So it's always best to seek professional advice, or professional help when trying to extract pus, whiteheads, blackheads from the skin, as opposed to taking it upon yourself and undoing it and risk scarring your skin. So, from a skincare point, for the mild and the moderate stages of acne, there are skincare available out there for all of you. So, let me start off with cleansers. Of course, the cleansers would either be a gel. In most cases, they're going to be a gel formulation for anyone who is dealing with acne. There are some lotions, and the lotions would tend to be more for someone who is dealing with a mild case of acne. If there is a lotion cleanser out there for an oilier skin, it would tend to be for someone who's dealing with a mild case, who is simply dealing with oily skin for the most part, and a few comedones on the skin. But in most cases, it is going to be a gel cleanser, specifically for oily skin. And now, when we come to the toner is going to be more of an astringent for an oily skin type. Exfoliation is very, very important when caring for skin battling, or with outbreaks. So anyone who is dealing with acne, has acne outbreaks, exfoliating the skin, as for any skin type. Um, but for acne, it is very important because, again, the cause of acne is an accumulation of dead skin cells sticking together, unable to remove themselves from the skin, causing the skin this backup in the hair follicle, which is producing the different types of comedones that you were seeing on your skin. So it is very important to exfoliate, and it is also very important to not use a mechanical an exfoliator, simply because by using a mechanical exfoliator, what you're doing is when you are exfoliating it on the skin with your hands, the chances of you erupting a pimple from that is great. And once you erupt that pimple and then that spreads onto the face, that is going to cause you to get additional pimples and acne on the skin. So it is very important to stay away from physical exfoliators. If I said chemical, I physical. So physical exfoliators, those with the granules in the product. People who are dealing with acne, pimples, you want to avoid a physical exfoliator at all costs because you do not want to increase the number of pimples that you already have on your skin. So you would want to use a chemical exfoliator or an enzymatic exfoliator, which is going to lift off, break down, or actually break down the break down the cells and break down what's going on with the stickiness of the cells and just remove it from the skin. So after exfoliating, and you're going to only exfoliate maybe twice a week for oily skin, twice a week. You may have heard of exfoliating 2-3 times a week is good, and it is, but not for an oily skin. For an oily skin, twice a week is sufficient. So, of course, then we have the mask, which you would follow up after using uh, the exfoliator. So after you finish using the exfoliator, you would follow that up with a mask. And so that's going to, after you've exfoliated the skin, your exfoliation is going to allow the mask to penetrate deep into the skin, allowing it to do the work that it needs to do to help correct the problem, or I should say, the concern that you are having with your skin. So then after that, there are serums for those who are experiencing severe or like breakouts on their skin. There are serums. There are serums to help combat the sebum secretion. And there are also, which is a little different. So that's more for the mild. Even though there are, more sebum secretions also with the moderate as well. But there is a slight difference because there's like oil. We want to, minimize the oil, and for a moderate or mild, I should say, a mild skin type of, acne breakout, they are basically dealing with oily skin and their occasional pimple here or there. So for them, basically, it is they are looking for skincare products that are going to help minimize the sebum secretion that they are experiencing on their skin, which is going to help minimize the pimples that they have on their skin. Whereas when we're going more into there's the mild and then there's the moderate. I'm tying myself up here. So the mild is the less of all four stages, and then the moderate, which we're dealing with the 10 to 25 pimples. And so with that, you are going to want something a little stronger. So there are, there are serums out there that are targeting that target that concern as well. So it's still targeting with oil, but it isn't just simply oil. It's also targeting the inflammation of the acne on the skin and helping to break down the bacteria that that are causing or that is causing the acne to flare up on the skin. After we're dealing with that, we have the serum. We also have the moisturizer. So there are moisturizers out there for oily skin, a light texture, and usually water base with oil in them. So usually they're like a liquid base. If they are cream based, then it's usually a gel that we are looking at for a more oily skin. And then also, let's see what else we have here. And then there's eye cream as well. And so with the eye cream, of course, you're going to want something that's going to hydrate the skin. Most people who are dealing with acne, they're dealing with it from their teens. Of course, there is adult acne for those in their 30s and in their 40s. And there are different, there obviously they would care for the skin differently. It's also in different places. So for teens, for example, in your teens or in your early 20s, you're usually dealing with it on your T-zone area. Not to say that it doesn't, of course, it breaks out on the cheek area and the chin area. On your chest, that is very uncommon for people who are in their teens, in their early 20s, on their chest, on their back, even on their buttocks, on their butt, breakout acne, pimples happen for people who are in that age range. So there are also cleansers out there that will help for the body. There are cleansers out there that will help for the body in reducing and minimizing the acne that you have on your body. But for that age group, that's where you're going to find acne. Now, for people who are in their 30s, in their 40s, and even in their early 50s who have what we call adult acne, it is primarily around the cheek area. So for that, and of course, especially with women in that age group, they're also concerned with anti-aging. There are products out there. More and more companies have invested in making products for women in those age groups who are dealing with acne. And of course, you're going to, like tailor suit, you're going to speak with someone about that. Obviously, a beauty consultant, an esthetician, which can help you develop a skincare routine that is going to target your concern with acne. Now, there are spot treatments out there, amazing, amazing spot treatments out there. I normally do not like endorsing companies. On this platform that I have, but I am going to endorse a few. Um, Origins has a really amazing spot treatment. Clinique, another one, excellent spot treatment, as well as La Roche-Posay. Amazing spot treatments. You put them on the skin night and day. They also have, I know for La Roche-Posay, they have one which is for makeup. So they have the clear one, but they also have a color pigmented spot treatment for makeup. So, but what you're going to do with the makeup ones, you're only going to apply those ones during the day. But for the clear ones, you're going to apply them night and day. I would always apply them as my last form of skincare. Some people, and it depends on the individual, I found for myself more effective, and the clients that I was dealing with, I found it more effective to put the spot treatment on the skin after I've applied my moisturizer on. So just before the sunscreen. So I would put my spot treatment wherever, like my concerns were, wherever the acne and the pimples were, that's where I would put the spot treatment, let it absorb into the skin. And then after it absorbed into the skin, of course, we are going to need sunscreen. So we're going to need sunscreen because, of course, we want the pimples to not, the hyperpigmentation we don't want. So we do not want any scarring. And to prevent any kind of scarring, we are going to need sunscreen. So sunscreen is necessary. It is a necessity when trying to correct skin from pimples and from scarring. And that really is another topic. That is another topic. But while we're talking about this, yeah, so you are going to definitely need your sunscreen. I mean, you need your sunscreen anyway, even if you're not dealing with acne, but it is very important. It is more so important when you are dealing with outbreaks and pimples that you apply sunscreen on the skin before applying your makeup or anything else. So if you're going to, so after you put the spot treatment on your skin, and then you're going to put your sunscreen. Let it sit for a while. Another thing that I did, and this is just me, my little kind of concoction here, when it came to spot treatments, is I like after I've cleansed my face and put my serum on. Um, so after I put my serum on, I would put the spot treatment on my skin, let it do its thing, for about a good 2-3 minutes. Then I put my eye cream on, then I put my moisturizer on, and then I would reapply the spot treatments to those same areas where I applied it on after my serum. Just kind of like making sure that I just insulated those pimples with spot treatment just to make sure that they get it. So that was just my little trick, so to speak, when dealing with reducing the inflammation on my skin. And also, the faster you deal with that inflammation, the faster any kind of scarring. So whatever kind of scarring or pigmentation is there as a result of the pimple, it will vanish. It will vanish. In some cases, you will not even see any pigmentation. If you put the spot treatment on the pimple, the second it breaks out. In some cases, with the ones like with the spot treatments that I have mentioned, if you get the pimple, as soon as you feel it, taking place. The second you feel that, oh my goodness, I feel a pimple coming, you put the spot treatment on that pimple, and it never even is able to give birth, so to speak. Like you have, in a sense, inflated the pimple from erupting or becoming larger. And so if you get it right when it's about to happen, chances are, 80% of the chances are, it will not even come to full bloom. You get it and it just sinks right in. And I mean, it's so amazing. I would see with the spot treatments, put them on a couple of days, 24 hours, 48 hours, you will even see how the inflammation has just gone down completely. Like you will see the area of the pimple, and you'll see exactly what happened as a result of putting that spot treatment on immediately. So you'll see how it's sunken in. You'll see a little bit of dryness because that's basically what it's doing. It's drying out. It's sucking out all of that oil that is plugging the hair follicle. So you will actually see the result of that once you apply the spot treatment. So spot treatment is very important. It is a very important skincare product that you need in your skincare routine to help minimize the acne that is occurring or happening on your skin. And in the long run, it will actually help to minimize and even reduce the acne that you are experiencing on your skin. So basically, that's all I have to say about acne and caring for acne. Also, yes, so I did mention just an afterthought here about skincare, about sunscreen, applying sunscreen after you've applied all your other products, including the spot treatment, because the sun does. What the sun does is it increases the melanin in our skin. So unprotected, the melanin in our skin um, increases, the production of it increases. So it's very important for that. So what I suggest also, if you wear a hat, to try and also shade off the sun from getting to your skin. That also would be a good thing, but still you need your sunscreen. But also wearing a hat to help protect your skin from the sun and from the sun accelerating the melanin that is in your skin from darkening the pigment of the acne. So now I am gone. Now I am gone. Skincare minute. And until next time, take care.